about window strike and predation a little bit. I should mention that these pictures I warn you about is mainly going to be of the neck that's going to be opened in the animal, but there is one picture of the internal organs of one bird. After I get through the other concerns of the bird feeders, then I'll discuss a little bit about prevention of diseases and what you could do with your bird feeders to minimize the risk of outbreaks, and then what you do if you do notice disease. So as Chantal mentioned, I am the wildlife pathologist, and I'm the wildlife pathologist for the Ontario and Nunavut region of the Canadian Wildlife Health Cooperative. And I'll talk a bit about where we are across Canada, but we basically cover the entirety of Canada, and my region is this province of Ontario, as well as the territory of Nunavut. And I've been there for about 2.5 years at this point. Most of what I do is necropsies, which is basically an autopsy on wildlife. The other term that I'll use for that is a postmortem. And for the most part, I'm doing birds. I'd say about 60% of the animals I do are birds. Just over a third are mammals, and then we do have the occasional turtle, snake, or frog thrown in there to cover reptiles and amphibians. Aside from doing the necropsy work, which is most of my job, I also work with a number of different agencies in working groups. So we do discuss things like research that we're going to be doing on wildlife. So I work with the Ministry of Natural Resources, OMAFRA, Public Health, depending on what the projects are and what they want to know related to wildlife. And then I do outreach like this. So this talk is one way that I'll do outreach, is talking to the public. I actually traveled to Nunavut in November of 2019 to give a talk on caribou diseases. And I'll talk to other agencies as well. So working with the Ministry of Natural Resources and giving presentations or doing labs. So this was actually an image from when I worked in New Hampshire, and this was working with the Maine Fish and Wildlife, or Fish and Game down there. And we were doing a lab on necropsy technique and wildlife, and specifically lynx in that case, because we were doing a research project on lynx in Maine. So the Canadian Wildlife Cooperative, we are a nonprofit organization, and we have 6 regional centers across Canada. As I mentioned, me being in Ontario and Nunavut, I'm located at the University of Guelph, and most of our centers are actually located at the sites of veterinary colleges. So we do have one out in the Atlantic, out in Prince Edward Island. Montreal has one, Calgary, Saskatoon, and then we have one in Abbotsford, British Columbia, which is the only one not associated with a vet college, but it's associated with a diagnostic lab out there. And most of what we do is wildlife disease surveillance. And that's basically all my job is wildlife dies, we bring it in, I do the necropsy on it, try and determine why it died, and then report that out to different organizations, as well as whoever sent it in to me. But in addition to that, we also do research. So I personally don't do a lot of research myself. I collaborate with people, but we do have our regional director, and she runs her own research lab, and all of the different regions do different research in their own labs. In addition to that, we also will work with government agencies and wildlife groups to enact policy changes. So if there is anything that we think could change that could potentially protect wildlife, then we will work with them to see if we can actually make some changes. Our funding, I should mention, is all from these governmental agencies. So Ministry of Natural Resources, Environment Canada, things like that. So because of that, we don't actually charge for anything that we do. So we don't actually force anybody to pay to send an animal in. We don't tell them that they have to pay for any lab work. However, because it is a service that we provide, we get to select what we bring in. So I'm not going to bring in every single wildlife that has died out there, because there are some that either are just too decomposed that I'm not going to be able to do much with, or we know why it's died. So for example, roadkill, we won't necessarily bring those in because we know why they died. And that's basically what my job is to determine why this animal died. And that's the kind of testing that I'll do on it. So before I get into the diseases, I'll just mention myself related to bird feeders. I should mention that I don't have any right now, and I'm definitely not a bird expert. I kind of came into this field through the veterinary medicine, through pathology, and then learning about diseases, and then eventually making my way into wildlife and studying the diseases of wildlife. So I definitely am not an expert on birds. So when I get a bird in, unless it's something obvious like a crow or a chickadee or a cardinal or something, there's often times when I get out the little bird book that we have down there to determine the exact species. So I'm definitely not an expert in that field. And it's not that I don't want a bird feeder. It's just, as you'll see, once I describe how I think that we should take care of our bird feeders, I just personally don't want to put in the work to do it, because there's a lot of cleaning and maintenance that's required in order to do it properly. So it's more just, I don't feel I have the time to do it more than anything else. So I do understand why people have it and why so many people do enjoy it. So I'm not trying to say that it's a bad thing to have them. I just personally don't have any at this moment. The one thing I will mention, and I'll come back to this later on as well once we discuss response to diseases, is something just to keep in mind that bird feeders realistically are just a supplemental food source for these wild birds. So the vast majority of these birds are actually going to do fine even if you don't have the bird feeders out there. There could be a few animals that do starve, because winter can be difficult for many animals that are staying here and staying active over the winter. But if you do need to remove your bird feeder, the vast majority of birds are actually going to be fine, and they'll make their way throughout the winter. They'll find food, and it won't be a big issue for them. And actually, those handful of birds that may die of starvation is probably better than the much larger number that would probably die if there was a disease outbreak. So that's kind of the balancing act that we have to play with in a case like this. When we do have a disease outbreak, we do have to think that maybe taking away the supplemental food source may be best for the population as a whole. So just keep that in mind when I discuss response to diseases. And just to transfer into the next part of my talk, I did want to mention that bird feeders can be a source of disease transmission. So they can be a place where birds will pass diseases on to each other. So with the diseases, I'm going to talk about three main ones. There's Salmonellosis, Trichomonosis, and Mycoplasmosis, and then cover a couple that you may either see, like avian pox at your bird feeders, or something that I just want you to be aware of, just so you know that you could potentially cause danger to these birds by putting out spoiled feed. And that's where aspergillosis could potentially come into play. So salmonellosis is one that is probably the most topical right now, I'd say. And that's because this is a time of year that we typically see it. So salmonellosis is caused by a bacterium. This one's caused by Salmonella typhimurium. And I'm sure most of you, or not all of you, have heard of Salmonella as a bacteria that can cause disease in people as well. There are many different species. This is just one of them, but this one can cause disease in people. So it could cause diarrhea, intestinal issues with people as well. But it is something that we see quite commonly in our songbirds in this time of year. So in the winter and spring, the cold weather months is really when we see this pop up. And most songbirds are actually susceptible to this. I typically will see it in sparrows for the most part, but that's mainly because I feel that's the most common bird that I've seen around here. So I think it's more just who's out there and who's the most dense population in our urban areas, and sparrows seem to be one of them. But it definitely hits many other species, as you'll see from some of the pictures I have coming up. And we do have a confirmed case of this already in Ontario. So it's from the Push Lynch area. We had some pine siskins that had died secondary to salmonellosis that I got in about 2 weeks ago. And the way that they get this is by accidentally ingesting the bacteria in the contaminated food or water, or just being exposed to the contaminated equipment, so the bird feeders themselves. And it tends to be the cold weather because the bacteria tends to survive quite readily in the colder weather. And you'll see that with the other bacteria that I'm going to talk about in a minute. So what are you going to see if you have a bird suffering from this? Most commonly for salmonellosis is this generalized poor health that you're going to see, kind of like this bird over here in this image. Just lethargic, not really wanting to do much, not moving much. Sometimes they'll be sitting on the ground by themselves. They're not eating or drinking really much. And this typical fluffed up feathers and really not doing anything is probably the most distinct feature of any sick bird out there. And we see it quite commonly with our salmonellosis birds. And they may also be shivering or just have a droopy head and just pretty much look sick overall. They may actually have some feed around the beak. This one doesn't have it, but as you'll see when I show you where the actual disease affects these birds, they can have a problem actually swallowing. So you will get regurgitation and drooling associated with this disease. So you can see feed stuck around the beak, and you can see them kind of pick up feed and then drop it again. Occasionally it will cause some more systemic, so go throughout the rest of the body and cause disease throughout the remainder of the body. And that's when you could see things like rapid or labored breathing. They're just sitting there puffing. And just like in people with salmonella, you can get intestinal forms of it. So it can cause diarrhea as well. And then occasionally, sometimes all we hear about is just these birds are dying in this person's backyard. So just sudden death all of a sudden is another thing that we'll occasionally see. So this is your first warning for a picture of a postmortem case. So this was from a northern cardinal last year that came in. So we've obviously got the beak up here, and then just below that, all this kind of white tan material is actually feed that it was taking in. So this is seeds that are just being partially chewed up in the beak, but then not actually being able to move beyond. And that's because what we've got here is this is the esophagus and the crop. So the crop is basically just an outpouching of the esophagus and basically allows the birds to hold on to feed as it slowly moves its way through the stomach, or the gizzard as it's called in birds. And it should be kind of this purplish, pinkish red color here. But as you can see, there's all these yellow nodules over the surface. So really just thickened yellow material. And what it does is it basically constricts the entire esophagus so that nothing can really pass through it. Often water can get through, but none of the feed material will. So with that, what we'll often see is that these birds often become emaciated, so they can't eat, so they basically start to starve to death, and they get very thin, which is what emaciation means. Or they can become dehydrated, so they're just not able to drink as well, so they will become dehydrated as well. In addition to this, sometimes we will see cases where it does go into the intestine. So that's when we see the hemorrhagic, so bleeding into the small intestine or large intestine, depending on where it goes. When I look at these cases under the microscope, it mainly is just cell death. So the bacterium really kills a lot of the cells in the area. And that's what we basically see under the microscope. And then to diagnose it, I just do bacterial culture is really all I need to do in a case like this. And that's what we did with the pine siskins, and it was confirmed as that. The second disease I'll mention is trichomonosis. This one's also called canker or frounce. And I think there's, in the UK, they call it fat finch disease or something like that. And it's caused by a parasite. So there's a parasite out there called Trichomonas gallinae. And that parasite is what causes trichomonosis. This one, instead of causing disease in the winter or the spring, this one actually causes disease in the summer and the early fall. So more in that warmer weather period. So a lot different from what we're hearing with salmonellosis, where this is the time of year for salmonella. Trichomonosis is in that warm weather, and that's because the parasite doesn't do as well in the cold. It actually does much better in the warmer weather. This has actually become a big issue in our Atlantic provinces over the past few years, to the point where I would say over the past 2 or 3 years, they've actually had a media blitz in the spring, basically asking people to put their feeders away for the summer because they've noticed such a big issue in their finch population with this disease over the past few years. It's kind of moved into that area recently and is causing quite a severe decline in their finch species. So I've mentioned finch a number of times just now, and that's because that's the main species that's affected by this. So we've been seeing it mostly in the purple and gold finch, but I mean, we do see it in house finches as well. And occasionally other species, but mostly finches. Historically, what we saw it in was pigeons and doves, and that's when it was called canker, and then raptors, and that's when it was called frounce. And with those, the raptors especially, you kind of wonder how you would get that, but it's because the raptors were feeding on these sick pigeons and doves and then picking it up directly from them. So that's how raptors were actually acquiring it. But any other bird, how they're acquiring it is just this accidental ingestion of the parasite in food or water. So again, we're talking about bird feeders and bass as sites of transmission because it's the food and water that is really the issue. So what you're going to see with this is similar to salmonellosis, but typically what we see more with trichomonosis is the animals will drool and regurgitate food, and they often have quite a bit of trouble swallowing food and swallowing water. And you can actually see the plumage around the face is quite matted down because it does get wet from just regurgitation and drooling constantly. You can also get labored breathing, and similar to salmonellosis, it does affect up in the neck, mouth area. So sometimes you will see swelling up there. And then, as I mentioned with salmonellosis, just this generalized poor health, lethargic, not really want to do much, doesn't really fly as much, all fluffed up again. But in particular, this one, the face is really where you see it. And part of that is because it tends to affect the oral cavity more than anywhere else. So it does affect up in the oral cavity. It can be further down in the esophagus and crops, similar to salmonellosis, but we do see it oftentimes in the oral cavity. So with them, it's hard for them to even take it beyond just the outer aspect of their beak, because they can't really even take it further into their mouth because it's just so swollen. And when we cut into those, we have all this kind of proliferative material that's hanging out in the oral cavity, or sometimes a bit further down. So that's what all this kind of white material is here. So as you can imagine, same as salmonellosis, you can't really swallow much there. So emaciation and diarrhea is something we can see as well. The diarrhea is often just from overall poor doing, but the emaciation, the body condition loss, is because they can't eat properly. Unlike salmonellosis, where I was talking about everything was dying, this one it's more inflammation. So you'll see a lot of reactive white blood cells that come in, and then you can occasionally see the parasites in there as well. So that's another thing that we'll occasionally see is the parasites on the microscopic slides. And then to diagnose this, we do a molecular test, a PCR to do it. And we can suspect it on microscopic exam, but we do need that PCR to diagnose it. And then the last one that I'll mention is another one for this time of year is Mycoplasmosis, which is also called house finch eye disease. And this is another one caused by bacterium. So I've mentioned 2 bacteria now, and they both tend to cause disease in the winter, colder months. And that's just because bacteria tend to survive much better in the colder weather and the parasites in the warmer weather. And this bacterium is called Mycoplasma gallisepticum. It predominantly affects house finches. We will see it in other birds as well. So I just want to draw your attention over here. We have a blog that we post, and we will post interesting cases as well as things that we are noticing in areas. So this is from Quebec, where people had sent in pictures to our colleagues in Quebec. And this he had published, our pathologist out there, on the 25th of January of this year, where somebody at their bird feeder had started to notice these finches with these swollen eyes. So we didn't get any cases to confirm it, but just based on that, we do suspect that this is mycoplasmosis. And it can, as he mentions in here, different finches, and then he also mentions some grosbeaks as well as other common species that can be affected by this. When you get this into an area at the beginning, it can be quite serious. You can see a significant decline in the population within the first few years of this coming into the area. And predominantly how this one, it doesn't survive as well outside the body as Salmonella does. So you do need to basically have the birds in a tight area for a prolonged period of time, because they basically need to exchange either the eye or nasal discharge, so sneezing and things like that, or just rubbing their face on something, then another bird gets up there and rubs their face on it. Those are kind of the times when you're going to see this pop up. So typically where we're going to see this is at feeders and roosting sites, and that's because you have a number of different birds that are coming into close contact with each other over a prolonged period of time, which allows for the disease to pass much more readily. So what are you going to see? It's pretty obvious with this one because it really does affect these eyes, and we can see 2 birds here with swollen red eyes. Sometimes you'll see discharge, so sometimes you will see kind of matting of the plumage again around the eye or around the nose, because it can affect the nasal cavity too. Sometimes the eyes can be almost completely shut, like this finch back here. And that's just because of the swelling that occurs within the eyelid. They just can't open their eyelid anymore. And then you can see crusting forming as well, because there is so much discharge. If they're not opening their eye all that much, a crust will just form over that eyelid too. If it affects the nose more, then what you'll see is more just discharge. Sometimes you'll see sneezing, or sometimes they'll be gasping for breath because they're not able to breathe through their nose as well. So they'll kind of be open mouth breathing. And I mentioned the wet feathers around the face. And then the last one, as we've mentioned with other things, kind of like this little guy here, just kind of poor health, fluffed up feathers, really not looking healthy overall. So on necropsy, this is what I see, basically the same thing. You have this swollen eyelid, a little bit of crusting over the surface, and sometimes reddening. And the crusting tends to be right along that margin where the eyelid kind of comes together. And then you can also see reddening in the tissue underneath. So the conjunctiva is where the blood vessels come in and feed into the eye and the tissue around it. And you can get reddening and reactive tissue there. And it's called conjunctivitis, which is just inflammation of that tissue. And that's what pink eye is. So this is basically pink eye of finches, mycoplasmosis. And what we'll see with that is more inflammation of the eyelid, of the conjunctiva under there, and of the nasal tissue, and then PCR and mycoplasma cultures, how we diagnose those. So those are the main three. So those are the ones that we typically will tell people to watch out for. But there are a few other things that you could potentially see. One of them is avian pox. And this one I'll mention because it's something that is quite distinct. And if you see it, then you'll notice it in these birds. And we've had a few cases where a number of mourning doves were picking this up. And you can see in this mourning dove, there's these huge masses over its face. So obviously that's something that if you see a bird come to your feeder, you're probably not going to miss that. Same with this turkey. They've got all these masses over the face, this crow on the feet. The good news with this is that each species has its own poxvirus. So you're not going to have a mourning dove poxvirus necessarily transfer over to another bird. So if you do see a mourning dove with this disease, it's probably just going to potentially affect other mourning doves or pigeons, closely related species, but not necessarily other songbirds in that area. We most commonly see it in the mourning doves, the crows, the turkeys, and occasionally the finches as well. One good thing with this is that it tends to be self-limiting. So the body is actually able to fight off the virus and actually resolve a lot of these masses over time. The problem comes into play when you have a bird like this, where it's basically covering the eyesight of this bird. So that bird is going to have trouble flying. It's going to have trouble foraging for feed. So that's when we're going to have weight loss and potentially increased predation because it just doesn't know what's around it. And it's hard to see in this picture, but there actually is masses right inside the oral cavity of this turkey. So that one is not going to be able to eat as well. So losing weight because it's not going to eat, similar to what we talked about with Salmonellosis and Trichomonosis. So the reason I didn't put this in with the big three for bird feeder diseases is because it seems like this is mostly transmitted by biting insects. So you'll see it in mosquitoes transmitted, flies, biting flies. There's possible that it could be contaminated feeders involved in the spread of this, but the studies haven't really shown how significant that is yet. And this is the warning, because this is where I'm going to show a picture of the internal organs of a bird. So if anyone thinks that they're going to be a bit squeamish, then probably turn away for this next slide. So this is actually a swan that came into us, and this is aspergillosis. So this is pretty rare. It's not something I see too often. It's mostly seen in waterfowl, which is why I have a swan here. I see it in swans, ducks, other waterfowl like that. Occasionally cormorants and other shorebirds as well. And you often see it in combination with another disease or in a rehabilitation setting. And the reason for that is the fungus that causes this typically isn't strong enough to cause disease on its own, typically needs the immune system to be knocked down a little bit before it actually causes disease. So you won't necessarily see it until the animal is dealing with another disease, or it's in a stressful situation like a rehabilitation center. And the reason I brought this up was infection can often result from moldy feed. So that's something I wanted you to be aware of. If you do have spoiled feed or moldy feed, you do want to be taking that away and not feeding that to birds, because you could potentially allow them to inhale these fungus that are on the surface of the moldy feed. Other concerns with bird feeders, things like window strike is definitely a concern. So this is what we'll see is this is the head of a bird where we've kind of pushed the skin forward here. And the normal skull here is kind of this whitish gray. And then this red is all hemorrhage or bruising on the surface of the skull. And that's because it's hit a solid object head on. So there are many websites. This is one that I'll just mention, BirdSafe. They're associated with Flap Canada. So those organizations are involved in trying to educate the public about what you can do about collisions with houses and structures. So there's a certain distance that you want your bird feeders from your house or close enough to your house. There's this in-between area where, unfortunately, if the birds are spooked, they may fly off and not have time to avoid your building. So that is one concern. And then there are things that you can do for your windows. So if you have windows that you're concerned about, you can do things like have this tape put on your window, which then basically breaks it up so that the bird can actually see the window. So if you imagine, if it wasn't for all these white dots there, this bird would look at this window and just see a forest beyond and not even realize that there was a window there. But having these dots there spread out in that way allows them to recognize that there is a solid structure there, and it's less likely they're going to hit the window. The other thing to mention about bird feeders is predation. It's not a huge problem for bird feeders in general, but it is something that you just want to be aware of and make sure that your birds that you're feeding have the ability to escape if they can. So we've got a Cooper's hawk there sitting on top of a bird feeder, but they will be a little bit more sneaky than that usually, and not just hang out right on the feeders. But you want to have enough coverage that if a raptor does come down, the birds that are feeding have a chance to escape and to brush around, so that there isn't a raptor just picking off the birds constantly at your feeders because they don't have a chance to actually hide anywhere. And there are recommendations online again, where you can find ideas as to how you can prevent that, or at least minimize the chances of that happening, so you don't just feed a raptor instead of the songbirds that you're hoping for. And then the last one I'll mention is probably the most controversial thing that I'll bring up today, and that's domesticated cats. And that's because people tend to fall on two sides or one side or the other of the fence, whether it's allowing domesticated cats to go outside or never allowing domesticated cats to go outside. I tend to sit on the side where I don't really want my cats to go outside, partially for their own safety, but also because I'm aware that cats are known to kill tens of millions of wild rodents and birds across North America every year, and they are a prolific hunter. So it is a danger to wildlife to have all of these cats outside, albeit most of them are feral cats. I'm not saying this is always an issue with owned cats, but owned cats will also kill wildlife. So for me personally, if I can avoid my cats actually being out in the wild and potentially killing wild birds or rodents, then I will keep them inside as much as I can. And there's a few ways you can do this. I'm sure if anyone owns a cat, they have had a cat in their past which wants to be outside. So I had what I termed a bolter, and that's because as soon as you open the door, she would try and bolt between your legs to get outside. So this is kind of what I did to fix that, is I built a catio. So it's basically just a structure on the outside of my house. It's not really connected to my house. It's just basically these are buried into the ground to give it structure. And it's attached to a window here, and allows my cat to go in and out. And it's covered in mosquito screening. It's got a little bit of a clear roof there, so the snow doesn't build on top. And I'm still minimizing the number of bugs that comes in. They also have kits that you can buy that can attach to the outside of windows. It's basically just a box that hangs out there. But as you can see, my cat still does get some outside time, as opposed to this neighborhood cat, which gets much more outside time. But I feel better about having her out there because she's safe, the wildlife around is safe. So that's just something that I've done. Other people will take their cat outside on a leash, or at least be there to watch them the entire time they're outside. So there are other ways to deal with it if you're concerned about having a cat outside. Before I move on to the prevention and response to disease, I just want to mention this. This is a document that was put out by the Canadian Wildlife Health Cooperative. And this was put out a few years ago before I started at the Canadian Wildlife Health Cooperative, and that's called Strategies to Prevent and Control Bird Feeder Associated Diseases and Threats. And if you go to our website, which I've got here, cwhc-rcsf.ca, and go to the reports tab, and then click under Assessment Strategies and Opinions, you can find that report, or just Google this title of the report and you can find it there. And that's going to go through basically what I'm talking about today, but in much more detail, and give you much more information about what you can do to help prevent bird feeder diseases, and then what to do if you do spot them. The other thing that we have on our website is a number of disease fact sheets. So those three big ones that I talked about, we do have fact sheets that are just these 2-page fact sheets that give a bit more information about the diseases. So if you want to read up on it, you're not remembering everything I told you today, it talks about clinical signs and what to watch for each of those. So that's another thing to look at on our website. We do have shorter information pamphlets available as well. So if there is anything else that you're interested in, you can always go see if we have info on it there. So there's a few different ways to help prevent diseases. One of the ways is basically if you've decided that you don't want to have bird feeders anymore, or if you're in a situation where there's an outbreak and you're forced to kind of take down your bird feeders to save the birds that are out there from getting infected, is to make sure that your yard is bird friendly. So just having habitat that encourages natural foraging, and that means having a natural source of food, water, shelter to attract birds to the yard. And that will still bring birds in, probably not as many and not as visible all the time, but they'll still be in your yard. And that would reduce disease transmission because they're not all coming together in a little area like around a feeder. So that's just one thing to think about going forward, is to look this up and see, is your yard actually bird friendly? And if not, then what can you do to make it a little bit more bird friendly and attract more birds to the area? When we're talking about feeders, one of the important things is to choose the right feeder. And what I mean by that is a few different things. First off, metal, glass, or plastic is the best. So wooden, you're not going to be able to clean that appropriately. It's quite porous. The bacteria and other infectious agents are going to fall into the wood and basically not be able to get cleaned out appropriately. Whereas metal, glass, and plastic, you really can scrub it, you can disinfect it well. So I do recommend getting that. Also having smaller feeders, and that's not going to allow a lot of birds to congregate together. Is that also, it basically encourages you to actually go look at the feed often. So the more frequently you're going to look at the feed, the more chances that you're going to catch feed that's starting to get spoiled. So if we look at this feeder on the picture here, we've got a perch on either side here, another perch here, and I assume another perch on the other side. So at maximum, you've got 4 birds that could be there, and they're spaced out a little bit. So you're not necessarily in direct contact with each other either when they're at a bird feeder like this. I'll show a picture of this after, or in the next few slides. But if you do have a feeder where there's a little trough where seeds are, and birds are picking it up from that trough, then you do want to have something over top to prevent rain from getting there and basically making the seeds wet and damp. So I'll show a picture of that to show you what I mean. And then the table feeders can be a bit problematic. So those are the ones where you've just basically got a flat table and all the seeds and other feed is on that table, and the birds are basically hopping around on top of it. Because they are birds, they're not just going to be feeding, they're also going to be pooping on it. So that can lead to fecal contamination of the feed. And that can lead to transmission of diseases. So Salmonellosis is passed in the feces. So if they're hopping around on top of that feed, you could get more disease transmission because of that. So I tend to recommend avoiding the table feeders if you can. And then the other thing I was going to mention is just the specialized feeders. So there's some feeders that will allow just certain species to feed, and that just reduces the contact between different species. And that can be important because you don't want to have a disease in one species that all of a sudden is transmitted to an entirely new species, because that can cause huge issues. And that's what we saw with trichomonosis. It started out in pigeons and doves, it hopped over into finches, and now it's causing huge problem for the finch population in many different areas. So that's mainly where we're coming from with this specialized feeders to select species to feed at. Very important thing is to keep your bird feeders clean. So minimum, I would say twice a month, you want to clean them out. When I was looking just for standard pictures of somebody cleaning a feeder, I ended up finding this screenshot, which I felt was the best. And that's because the person doing the cleaning is actually wearing rubber gloves. There were many pictures that I found of people just barehanded washing these bird feeders. And as I've already mentioned, salmonella is a zoonotic agent. That means it can be transmitted from an animal to a person and cause disease in people. And birds carry other bacteria and other infectious agents that can be transferred to people. So you do want to protect yourself when you're cleaning them. So make sure you have a pair of rubber gloves that is specifically used for cleaning bird feeders, and just leave them there. And that's part of your cleaning materials. And you can have brushes that are just for cleaning the bird feeders, and that'll keep you as safe as possible with this. The first thing you want to do is just scrub with hot soapy water to clean off the debris and feces. So you really want to focus on the perches and areas that the birds are putting their heads, because that's where the contamination is going to be. Because if we're talking about mycoplasmosis, I talked about it's wherever they're rubbing their heads. And same with salmonella, it's going to be where they're pooping or where they're rubbing their heads as well, or sneezing on or rubbing their drool from salmonella or trichomonosis. And then once you do that, you want to let it dry and then disinfect the feeder in a diluted bleach solution for a couple minutes. And once you've done that, you do want to rinse it very well, just to make sure that you rinse all the bleach off, and then allow that feeder to dry at that point. And by doing that, you're going to get rid of the vast majority of infectious bacteria, parasites, or whatever else is on the surface of these feeders. One other thing to think of, and the other reason I like this picture, is you can see that we've got an intact bird feeder here, and then we've got it completely taken apart. So each part of this bird feeder comes apart so that every little bit can be clean. So that's another important thing to think about with your bird feeders is, can I take it completely apart to really scrub down every single area of the bird feeder well. So this is what I mentioned about the feeders with a little trough here, having a little cover over the surface so that when it rains, it's less likely the rain is going to come in and collect down here where the seeds are sitting. And that's going to prevent seeds from getting really damp and wet. And definitely if you do have feeders like this, after you do have a rain, you do want to go out there and check it, because you may have to take the seeds out of there and dry it out appropriately before putting stuff back out. But you do want to be doing this on a regular basis. You want to make sure that you're monitoring your feeders. You want to look for any soggy or foldy meat or moldy feed or anything like that that suggests that the feed is becoming spoiled at this point. And then the last thing to prevent disease is probably what you're doing already. And probably one of the main reasons you have a bird feeder is that you want to watch the birds that are coming to the feeder. So not only do you want to watch to see what species are coming, but you also want to watch to see, how are these birds doing? Is there any evidence of disease? So I've already mentioned these birds that are sitting on their own, not really eating or drinking, all fluffed up. So that can definitely suggest that there is a problem with the bird. Mycoplasmosis, I talked about the swelling around the eyes. So if you do notice a finch or any other bird out there with swelling around the eyes, then that could suggest that that disease is present in the area. And then, as I mentioned with trichomonosis, but also with salmonellosis, you can see matting of the plumage around the beak and difficulty eating, regurgitation, drooling, that sort of thing. So any of those symptoms could suggest disease going on near your feeder. So what do you want to do? So I would suggest, before even doing this, And this part, I'm going to say, just do it quickly and then go out and remove your feeders. But if you can, take a picture of what you're seeing. If you can't get a good picture, it's not the end of the world. But if you're able to get a picture, and I'll tell you why in a minute. And then once you've done that, which again, don't spend much time, get out there, remove your feeders, remove any bird baths or anything else, and bring them in. Discard of any feed that you have in there and really clean and disinfect these feeders really, really well, and disinfect bird baths as well. Now, I had mentioned at the beginning about bird feeders being a supplemental food source, and the reason I mentioned that was because we typically recommend that you leave the bird feeders inside until the end of the known transmission period for that disease. So if we're talking about Trichomonosis, which happens in the summer and the fall, the feeders, we typically recommend leaving them out until we get that first prolonged cold weather or frost of the winter. So you basically have to leave them out the entire time that it's warm out there, because we do know that disease is in the area. And we know that if we have bird feeders, it's going to be more readily transmitted from bird to bird. For Salmonellosis, Mycoplasmosis, it's a winter spring, so the cold weather. So again, we want to leave it out the entire winter if we can, once we see a disease outbreak happening. And then at that point, you can return the feeders once you get the warm weather and the emergence of insects in the summer. So that's where I mentioned these supplemental food sources. Even though we could potentially have a few birds that die of starvation because they don't have that supplemental food source, the vast majority of birds are actually going to be okay. But there is the danger that with a disease outbreak, we may actually have more death if we left the feeders out. And this is where that whole getting your yard to be bird friendly also comes into play, because if we do have a salmonellosis outbreak around this time of year, and we're asking you to keep your feeder in and not put it out until the spring or summer, then at least you do have the option of birds still coming to your yard and still foraging with the decreased risk of actually transmitting disease at that time. The next thing to do would be to call us at the CWHC. So I have our number here and our email. Right now with the pandemic, the person who handles the calls is working from home. So they're more monitoring calls and will return calls, but there may not be a person to answer the phone, but you can leave a message for us. Or if you do have a picture, you can always email it to us. So that's why I mentioned the picture, is because if you send it to us, I could potentially then look at that picture and then say, okay, this is what I think's going on, and at least give you some information about what I think might be happening. And our eventual goal is to actually track these sorts of things. So this is our Trichomonosis site on our website, where we've started to try and track observations that the public has seen, as well as confirmed cases. So these gray pins here out in Nova Scotia are Trichomonosis cases that were reported to our colleagues out in the Atlantic office. And they unfortunately didn't get any birds in to confirm it, but they at least know that it's in the area based on the descriptions people are giving to them. And then in Quebec, they did get a few cases that they were able to confirm it in. The next thing to do would be to contact an authorized wildlife rehabilitator, so somebody like Chantal. And if you live in Ontario, but you're not close to where Chantal is, you can always go to the Ministry of Natural Resources and look for an authorized wildlife rehabilitator. They do have a nice table there that shows you a list of authorized rehabilitators, and you can always call them for advice, because there may be an animal that could be captured by somebody and treated potentially. And then the other thing to do is you can always contact the Humane Society if you're concerned as well, because they have people who are trained to actually capture wildlife and potentially take it to somebody like Chantal if they think rehabilitation is possible. So that's what I would do if you were to see a disease out there. And then what do you do if you find a dead bird? So this is where we really come into play, because now my job is important to you, because I can actually take that bird, perform a necropsy, and tell you exactly what I think has happened to that animal. I'm not going to guarantee 100% success, because we do have cases where we're not able to determine what caused the death of them, but we have our number and our email address there. Always contact us. We're there for normal business hours, but we will return your call if you call after hours. the next day or the next business day that we're there. And as I said, we don't charge for anything. We're just basically looking to get animals in. The most we might ask you is to collect and then submit them. But that might be as little as basically bagging it up. And you can, especially with a small songbird, you can basically treat it like you're picking up dog poop, where you basically have 2 or 3 garbage bags and basically invert it over your hand, pick up the bird, and then get it over and tie off that bag. Using disposable gloves is also important. If it's a larger animal, I often tell people just get a shovel and then just pick it up with a shovel and put it into a bag and then tie up that bag. And double bagging is best. I know not everyone is like me and they're not willing to keep it in their own freezer until we can get a cooler to you. So if you don't think you're going to be able to hold it on your own, speak to our employee who's going to be talking to you about it, and they can often find somewhere to take it. So what we've been able to do for people is they've collected this animal, they're not going to be able to hang on to it, but we contact veterinary clinics in the area, and there are many that will actually help us out and hold on to animals for us frozen before they can send it back to us. And then what we do is we ship a cooler out to that area and then actually bring it in. And we're covering all of those costs. So we're sending a way bill and allowing you to then ship it back to us. And then we bring it in and do all of the diagnostics, and you'll get a report as to what I found and why I think this is what caused the death, or if I can't find anything, what I've at least ruled out. So at this point, we have a bit of time, and I think the chat's been lighting up with some questions. So I think that's how I'll handle is I'll basically open up the chat and answer questions as best I can. There are going to be things that I'm not going to be able to answer when it comes to specifically things like changing things in your environment. That's not my specialty. So I'll probably just refer you to other places, but I'll do my best. So there's one about sparrows could be the case because they remain in large family flocks and not really exchanging members. That's true. So yes, they are going to spend a lot of time in flocks. So that's transmitting between them quite readily. That is a good idea. How long does Salmonella survive in the environment and around the area? I don't know off the top of my head, but I think Salmonella typically will survive, especially the colder the better, actually. They can survive for days, weeks, months. And the reason I say that, especially if it's really, really cold out there. So when I actually take samples, from these birds, I will take them, put them in bags. If I'm not going to submit them for bacterial culture, I will put them in the freezer and basically just freeze them at -20. And they will survive there for extended periods of time. And I could take them out 6 months later, send them up to the lab for bacterial culture, and they'll be able to grow them. So it really depends on the temperature outside as to how long they can survive, but they can survive for days, weeks, or longer. I see blue jays picked over like that. I thought it was other jays picking on it. Could it be this disease? I assume that was about avian pox. It definitely could be avian pox. So blue jays are a corvid, so they are in the same family as crows. So it's likely that they do have a similar pox virus that could affect them. I personally have not seen a blue jay with pox, but I wouldn't put it past them to have some sort of pox as well, pox virus. Can Salmonella be transferred from the infected area to others like cats, dogs, and people? Definitely. So that's one concern, especially on the ground around the bird feeder as well. If there is a bird down there that is having diarrhea or just walking around and staying in that area, Salmonella is going to be down there. So it is definitely a danger for people and dogs and cats that are going to be walking in that area. The good news for dogs and cats is that they're not as susceptible to Salmonella as many other species are. So that's at least the good news, that even if the dog is out there, even if it were to pick up Salmonella, it likely isn't going to cause a significant concern for the dog. They can have disease, but it doesn't always. And people, definitely it could be a concern for people. So it's just something to be aware of. If you are out there and you're out there in the backyard, you want to be careful around areas where Salmonella might have been. I don't know if it's being recorded. I will leave that to Chantel. Safer inside, you'd have to Can hydrogen peroxide be effective as an alternative to chlorine bleach? That I don't know. I would say look at a document that I had mentioned earlier, and look at other sites that discuss that. I personally don't know enough about cleaning to know how good hydrogen peroxide, especially the concentration that we have as an alternative to chlorine bleach. Hydrogen peroxide at a high concentration is a very effective disinfectant, and that's the main disinfectant that we use at my work to kill all of the infectious agents that come in. But we can only buy over-the-counter hydrogen peroxide at a much lower concentration, so I'm not convinced that it would be a efficient disinfectant, but it's definitely something to see what other people say about how effective it can be. But my thought would be likely not, just because the concentration is a little bit low for what we're able to buy as the public. The feed that drops to the ground, I would say if you can clean that up as best you can, it's going to be hard to do it. But if you do have feed that's on the ground, then just scooping it up and trying to toss it is also a good idea, just to try and minimize it. But eventually, I mean, a lot of that's going to get knocked down and it's not going to be a big concern. Yeah, so there's concerns about bird feeders in fall and stopping natural migration. I'm not going to touch that because I'll just talk about diseases. Can squirrels pass disease to birds? It's possible. I haven't heard of anything specific that squirrels would pass on to birds. I mean, any species could pass on diseases to another species, but it's not something that we really are worried about. And I personally haven't heard about any squirrel diseases jumping to birds. And squirrels, we don't see Salmonellosis, Mycoplasmosis, Trichomonosis, those other ones I've talked about. When I fill my feeder, should I be wearing gloves or washing my hands when I'm done okay? I mean, when you're filling your feeders, I personally would just be safe and wear gloves if you can, but I mean, washing your hands afterwards is probably fine. You're likely not going to be handling the perches and other areas that the birds are touching when you're filling it. So I'm sure just filling it with your hands is fine, but you do want to take precautions because there always is some danger. So it's really what you're comfortable with, I would say. So the pine siskins, so you were the one who submitted them. So why was salmonella not affecting the other species of birds? I only saw one junco affected. And salmonella is something that it's the same in people. Some birds will be affected more than other birds. I don't know specifically species differences, and that could be a difference between the type of salmonella, the species of salmonella that is affecting these birds, and why some birds may be more susceptible than others. But we do know that there are a lot of carriers out there. So there's a lot of birds that have salmonella in their gut naturally, and they're able to survive without a problem. And they're the ones that are actually the ones transferring it to other birds. And then those birds are these other birds getting infected are the ones dying. I don't have a specific answer for why the pine siskins were dying and the juncos were not. I don't know enough about juncos to know if they are more resistant to this species of salmonella or not, but that would be my guess, is that possibly those juncos are just a bit more resistant than the pine siskins are. I don't know about stale seeds harming finches. Flat feeder with a roof, open sides, but the flat bottom is a screen. Should I be concerned? I've seen that reported on some bird sites where they recommend those with the screen. I would say it's better than the table ones, but there is still a little bit of a concern because the birds are still walking on the seeds and potentially fecal contamination could still happen. It's definitely better, but anytime you have the birds walking on top of the seeds, that could potentially be a problem for them because you can get disease transmission with that fecal contamination. So definitely better, but I'd say not perfect because of that. Is it best practice to move my bird feeder so that the ground beneath it is fresh from time to time? Truthfully, I don't know the answer to that. I mean, I could see how that would be a concern of disease building up in one area under the ground. I haven't seen any evidence to support that. So I really don't know the answer to that question, whether or not diseases are going to accumulate on the ground underneath the bird feeder if you don't move it. Do we need to take additional or other cleaning steps with suet feeders? I don't know specifically with suet feeders. I would say probably not. I think with the clean, if you're able to get those feeders open, because I don't have bird feeders, I don't know the specific differences between suet versus normal feeders with the seeds. If you are able to open them up and actually take them apart and clean them appropriately, then I don't think you do need to take additional steps with those feeders. Can I spray 70% alcohol on the ground to eliminate potential salmonella? I would probably not do that personally, just because you're then spraying alcohol on the ground. You don't know what damage that could do to the ground. And I don't know how well that alcohol is actually going to penetrate, because salmonella is going to get into the dirt as well. I don't think that there's a big concern for the salmonella in the environment in the ground as much, because as long as nobody is down there really getting their hands in there and really digging it up, I don't think it's as big a problem for the ground. But yeah, I mean, I personally wouldn't worry too much about trying to sterilize the environment. That's something that I think will be naturally taken care of, especially when we get to the warm weather. As I said, that salmonella is not going to last well in the warmer weather. So I don't think it's as big a concern. Heard and also noticed a decrease in house sparrows. Are you aware if a disease is affecting them? I haven't seen anything specifically with house sparrows, aside from the occasional Salmonellosis outbreak. Definitely, if you do have dead house sparrows, send them in to me. But I have not heard of anything specific related to them at this point. What about cures? If we spot birds with diseases, how can we help the sick ones? That's where Chantal comes into play. Definitely contact her or another wildlife rehabilitator and ask them for advice. I would definitely not be one to touch that. I would say talk to the experts like Chantal about that if you do see a sick bird and what you can do to help. Most of the time, the things to do to help is going to be send it into somebody like Chantal who can take care of it. Are the red berry looking poops from bluebirds normal? I have a platform feeder and find a lot of those. I clean them daily. I feed the blue meal. I'm pretty sure they're from China. I hope it's safe for them. I don't actually know about that. I've never read berry looking poops. I assume that's more what they're eating. So I assume that would be normal, because if they are eating red berries out there, then that would explain it. I assume it would be normal, but I haven't actually seen that. Is this a cage suet feeder more likely to transmit disease like salmonella? Have you found any chickadees, woodpeckers, and nuthatches affected by salmonella? I do not recall seeing any of those species with salmonella. And I don't know the suet feeders being more likely to transmit it because of the caging. If you can clean that caging and disinfectant, then I'd say no, probably not. And I don't know, again, there could be differences in how susceptible some of these species are, but I don't recall seeing chickadees, woodpeckers, or nuthatches affected by salmonella. So it's possible those are more resistant species. Is the source of bacterial infection from birds who are carriers already infected, or can bacteria grow from a buildup of feces? It can grow in feces outside of the body, but not often. You usually need to have some sort of food source for the bacteria to actually proliferate. And these bacteria, they're going to proliferate better in a warmer environment. So especially this time of year, sure, the bacteria survive out there, but they're not going to necessarily be dividing when it's -3 or -5 out there. They're mainly going to be just surviving out there and not really growing in the feces. So you definitely can see it in a bit of warmer weather potentially, but there's not a lot of food for them in that feces. So they're not going to be able to grow all that well. And they're going to more go into a state where they just survive more than anything else. And it's more the carriers, they're the ones who are going to be bringing it to the bird feeder and infecting the perches and things like that, which then potentially could affect the other birds. can birds infected with Salmonella be saved by a rehabilitator? Chantel, I will let you cover that one. I do not deal with live birds, so I'll leave that up to Chantel to answer that question if she can.
Yeah, yes, we can if we get them soon enough, and also is a little bit dependent on the size of the bird. The really, really tiny ones are more difficult to treat because it's pretty difficult to run IO fluids in a tiny, tiny bird. But yes, we should be able to at least treat them, and if we get them soon enough.
Perfect. Are there any other questions anyone has for me?
Oh, well, there you go. That was a fantastic. Oh, you're getting a thank you. Okay. So you did a fantastic talk. It was very inclusive of everything that I could have wished for myself. So very much appreciate it. I did record it. Do I have your permission to post it?
For sure. Yeah, you can definitely post that.
Wonderful. I appreciate you doing this, Brian. Thank you very much. Bye,
Thank
everyone.
you for having me, everyone.